We're back with Dr. Kelley Gebhardt, a veterinarian at Happy Tails Veterinary Emergency Clinic in Greensboro. We're talking about pet emergencies and care and insurance and all that kind of stuff. All right, so someone has written in, how do you treat an ongoing and constant ear infection of my 12-year-old dachshund? I give special baths at least once a week. I've tried creams and pills from the vet. Nothing ever makes it go away completely.
Sounds like he needs to be seen possibly by a veterinary dermatologist. I think that would be really important. It needs to be further explored because he may have an antibiotic resistant infection. It may be really deep in the ear. And again, addressing the underlying issue, which is most commonly allergies for ear infections. Allergies are cause problems so many ways in pets, but you got to address the underlying problem and then get to the root of that infection. And it may take weeks and weeks of treatment with the appropriate antibiotics once the ear infection is cultured and determined if there's antibiotic resistance. And they may even need more than that, like a deep ear clean under anesthesia or other things. So veterinary dermatologist would be a great idea. Dr. Amy Randall does have a clinic in town. You could look her up online, Dr. Amy Randall, and schedule an appointment with her without a referral from your regular veterinarian.
All right, this person's asking, does your clinic give rabies vaccinations without requiring an exam?
No, we do not. We actually the only vaccine we give is rabies, but we do it for patients with bite wounds of unknown origin or bite wounds from unvaccinated other dogs. So we do not do rabies vaccines for general.
So if people are looking for a rabies vaccine without an exam, they need to go to like a rabies clinic or something of that nature?
Yeah, rabies clinics, especially kind of the pop-up rabies vaccine clinics, usually have just a very limited exam and will just give the rabies vaccine. And you can check with your regular vet to see if they will give a rabies vaccine without an exam.
All right, this person's asking, why does my seemingly healthy 3-year-old cat just throw up randomly?
It may be food sensitivity, maybe excessive grooming and hairballs, maybe some, inflammatory bowel issues. Hard to say, but if it is frequent, you probably want to check with your regular vet about that to see if they can further explore that for you.
So, do all vet offices accept pet insurance?
That's a good question. I don't actually know that. Well, let me tell you this. You can, even if so the answer to that would be, you can go anywhere and then submit your veterinary invoice to your pet insurance, but not all clinics do direct pay. That would be the answer. Because we accept direct pay. We just started doing that within the past year where TruPan will pay us directly. So it alleviates that immediate financial burden for the client. Not all clinics do that, but you can submit any invoice to your pet insurance for reimbursement. So the vet clinic doesn't have to accept the insurance. So
Okay.
It works a little differently.
Gotcha. At what age can you put a flea collar on your puppy? They have, I think they call a smorky.
Smorky, cute. Well, it really depends. I don't recommend any over-the-counter products, like over-the-counter hearts or flea tick collars. If you're going to get a collar like Seresto, you want to get it through your veterinarian. And there is an age and weight limit for that. And honestly, I can't remember because it's not something we carry, but I would imagine it's a minimum of something like 4 pounds, 2 or 4 pounds in 8 weeks or something like that. But I definitely don't recommend those over-the-counter collars. They're not effective, and I've seen too many reactions to them. So talk with your regular vet about the option for a Seresto collar if you'd like to go that way.
All right. This question is, what do you do if what do you do if your dog is bit by a snake?
Take him to a veterinarian right away, as quickly as possible.
Okay, and so this is one of those things where it's like if you know that the dog was bit by a snake, they start like swelling up or whatever, you get to the vet like immediately. You don't wait till the next day.
Absolutely. Yeah, because antivenin is most effective within the first 4 to 6 hours after a bite. And antivenin is the only thing that's going to bind up the venom and stop it from doing its job. And also making sure that they get a proper assessment and wound care and antibiotics if needed, because there can be not just what we can see problems that happen from the snake bite, but internal complications from the snake bite that need veterinary care. So you want to get them assessed and appropriate treatment. And boy, those snake bites hurt. So getting them pain relief is very important.
All right, we have just under a minute. I know you wanted to say something about your dog's surgery.
Yeah, so thanks so much for asking. So both of my dogs blew their cruciate ligaments within about 18 months of each other. My boy dog ruptured one of his cruciates. My girl dog ruptured both of her cruciate ligaments within a year. So that was 3 orthopedic surgeries within a period of about 18 months. Each surgery cost about $4,500. And because we had pet insurance, thank goodness, it took it down to about $500 per surgery. So instead of paying $12,000 in orthopedic surgeries in a year and a half, we paid about $1,500 for 3 orthopedic surgeries.
Yeah, that's
And
a whole
that
lot better.
is so much better. And it basically paid for all of the premiums for their entire lifetime up to that point. So all the money we paid in premiums, monthly premiums, had been
Right.
paid for in the money we saved.
All right.
So it was totally worth it.
Yeah, totally worth it. All right. If you missed any of this, this is going to be in the 2 wants to know section of our website.